My name is Chiadi Ndumele. I'm an associate professor of medicine at Johns Hopkins University, where I direct obesity and cardiometabolic research. I'm also the co-lead and the chair of a recent presidential advisory on cardiovascular kidney metabolic health for the American Heart Association, as well as an accompanying scientific statement on the clinical evidence and the gaps in our understanding and approach to CKM syndrome. The concept of CKM, or cardiovascular kidney metabolic health or syndrome, reflects the fact that there are close connections among metabolic risk factors like obesity and cardiovascular disease with chronic kidney disease and the cardiovascular system, and that these conditions together really result most consequentially in premature mortality. Also, we know that CKM syndrome has a greater burden among individuals with adverse social determinants of health and is a key contributor to health disparities in the population. And we also know that CKM syndrome leads to fragmented care related to patients having to navigate multiple providers with often differing recommendations and sometimes suboptimal communication and collaboration. Despite these major challenges associated with CKM syndrome, there's a lot of real possibility and opportunity to optimize CKM health in the population. There's a better scientific understanding of the connections among these conditions. There are a powerful array of new therapies that impact metabolic risk factors, impact chronic kidney disease, or impact both, that also have an impact on lowering cardiovascular disease risk and event rates. And we also have growing evidence on models to help clinicians from different specialties and disciplines to work together to provide holistic care for patients. So this new presidential advisory lays out the definitions for CKM syndrome. It provides a staging construct to be used both among adults and in children that really focuses on a life course preventive approach for identifying CKM syndrome factors early and promoting prevention to progressive CKM syndrome severity and cardiovascular disease. There's also a focus on systematically addressing social determinants of health, emphasizing approaches to support interdisciplinary care, and thinking about how we could all work together to provide holistic care for patients. So exciting that this is taking this important step forward for recognizing and addressing this important syndrome that has an impact on cardiovascular disease rates in the population and is driving adverse trends in cardiovascular mortality, knowing that addressing CKM care can really improve outcomes for the whole population in an equitable way.